Welcome to One Man at a Time, the KEMEN Show. Please like and subscribe to our channel.
The KEMEN Show. We are strong together.
Hey, welcome to the Global Connector, Diaspora Media Max Radio. It's another beautiful Saturday the Lord has created for us. And I hope everyone out there, you had a wonderful and a blessed Thanksgiving. It was a Thanksgiving week on Thursday. And we are doing great here in California. And I had a very blessed Thanksgiving, although I was taking care of the corona patients. How is you, Dr. Aris? Welcome to the show. And I'm going to take this opportunity to welcome all our viewers and our listeners out there. Welcome to Diaspora Media Max Radio. This is Wellness and Health Show presented to you by KEMEN. And KEMEN is Kenya Men Mental Health organization that helps men to keep sane and to keep checking on each other, to be brothers keeper. Welcome to the show. And Alice, say hi to us, please.
Hello, Alex. Hello, listeners. So my name is Alice Munya, and I know Alex likes to call me Dactali, and I'm working on that. in 2 years, I'm going to start the process. So, but I am a nurse practitioner. And if I do become a doctor, I will become a doctor of nursing practice because I love being a nurse.
Yes.
I think it's a great it's a calling. It's not even a profession. It's a calling.
Good to hear that. Mm-hmm.
Yeah. So anyway, today's topic, we're going to talk about PCOS. And I know people are wondering, what is PCOS? So let's jump into it.
Ovarian syndrome.
Yes. It's polycystic ovarian syndrome. Mainly affects women. And I know last week, if you didn't listen to last week, you need to go back and listen. We were talking about ovarian syndrome.
Mm-hmm.
No, we were talking about ovarian cyst.
Mm-hmm.
But that's when a woman has one cyst. So this one, today we're talking about many cysts.
Mm-hmm.
So yeah, so we're going to talk about it. A quick overview on the problem is, so polycystic ovarian syndrome, in short, is called PCOS.
Mm-hmm.
And anytime you hear the word poly, you already know it's many.
Many.
When you hear the word syndrome, you just know that they don't know what it is, okay? So, because it presents itself in many different ways.
So it's many cysts that's there with no known cause.
Yeah, they don't know what is causing it, and they do say that. So basically, it's a hormonal disorder common among women of reproductive age, but they don't know what really causes it. And I love that because I know people are gonna learn something today, because we're gonna dissect the problem and we'll prove what causes it, cause and effect. So, okay, yeah. So what's going on with the women? The number one thing that's going on, they have prolonged irregular menstrual period. Sometimes the periods are so irregular, but when they have a menstrual cycle, it is prolonged more than maybe 7 days, more than 10 days, and they're miserable. They're in pain, they're miserable, they're irritable, all that good stuff. Not good, but you know what I mean. The other thing is they're producing a lot of male hormone, and you have to wonder
how.
Why are they producing too much male hormone? Now, prior to last week, we had talked about uterine fibroids, right? And we dissected it, and we came up with women just being in that role of a man. You're fighting like a man, but your body really was not designed to do that. So that's why they're producing too much male hormone. And they do it in two ways. The ovaries overproduce what we call estrogen. So you have estrogen dominance. And I'm telling you, estrogen dominance, when you have it, you have a hormonal imbalance. And most women will behave like they have it. Yeah, this is estrogen now. We are talking about estrogen. So, but I'm going to get to the male hormone. When you produce too much estrogen and very little progesterone, you're going to have a hormonal imbalance, and most women behave like they are bipolar, or, you know, they are very, very irritable. One day, and this goes with their hormone changes. One day, 1 week, they're behaving like an angel. The next week, they're the opposite of an angel. So that's what bipolar means.
Wow.
So there's also something else that produces the male hormone. So number one, your ovaries also produce, when they have estrogen dominance, they're also producing a little bit of testosterone. And they can produce a little bit, but when you have estrogen dominance, you have a little bit more male hormone also. But another thing that produces the male hormone is the adrenal gland. So the adrenal gland is the one that produces epinephrine, cortisol. So when that just tells me that this woman we're talking about is under a lot of stress. So the adrenal gland produces a hormone that's called let me see where I wrote them, because I can't pronounce the DHEA. I have trouble pronouncing the full name, but I'll try. It's dehydroepiandrosterone. I got it. Woo. So, but the abbreviation is DHEA. Yeah, that's a precursor for testosterone. So when you find a woman who is having too much male hormone, they are at war. But with who? So that should
with
be
your body or with who?
With somebody else. They just had a lot of stress.
You are a woman, and your problem that's causing this polycystic ovarian syndrome, because you're producing too much of male hormone, but you are ready. And you are saying that your body is in a war with who? Who is causing this woman body to produce the male hormone?
Good question. So when you are at war with yourself, normally you develop autoimmune disease. PCOS is not autoimmune. It's an inflammatory syndrome. So you are at war with someone outside of yourself. It's a relationship. There's a relationship that's not working. Okay? Well, we'll dissect it.
Okay. Bro Mash is saying, repeat today's topic. Bro Mash, today's topic is polycystic ovarian syndrome. This is a syndrome with female or children bearing age.
Okay, so the number 3 thing that's happening, remember when we dissected ovarian cyst, we talked about the functional cyst, the 2 most very common cysts. And we say that with time they disappear, like within 3-4 months, they're gone. But when you're having polycystic ovarian syndrome, you are actually having functional cysts, but they are many. So you're developing the egg, but you're not releasing the egg. You're holding on to the egg. And that's what's causing
your body, we're talking here about the ladies, listen. So your body has an egg. Many eggs, and it's releasing it, or it's not releasing it.
You got it, Alex. Good explanation. So that causes a lot of problems. So you have estrogen production, you're producing the male hormone, and you're holding on to your eggs. Major problems are going on here.
So you're holding on to your eggs, you're not releasing them because of the male hormone.
Because of the stress.
Because of the stress. Technically,
technically, you know, when you dig down deep, when you remove all the layers, there's a lot of stress that's going on. Okay, let's quickly summarize the types of ovarian cysts. There are 5. And we said that we did them last week. We said the most common are the functional cysts. And the 2 very common ones are the follicular cyst, where you don't release the egg. It's only 1, but you don't release the egg. And it starts growing bigger, and it gets filled with fluid. And so your body senses that as abnormal. It's saying this is not supposed to be happening. So inflammation starts. And you know, inflammation comes to heal. But when the soldiers and all the fluids and all the complements all come to the site of infection, because they see it as an abnormal, it's an infection, even though it's not a bacterial infection. So it keeps swelling, it gets bigger, and it could get very big and burst. And if it bursts, you have internal bleeding, and that's not good. The second one is where you release the egg. It's called corpus luteum. So you release the egg, but the place where the egg came out, it doesn't heal, it doesn't close. It becomes like a small open wound. So your body once again activates the immune system to come and heal the area, and the area fills up with fluid. So that's another way to form a cyst. And then the third one is the weird one, the one we were talking about.
The one in the hair?
Yeah, the dermoid cyst. The one that is a teratoma. So a teratoma is solid.
And this one thing I want people to know. It's like, so bro, Marsh, if you go to the hospital and we are being told, God forbid, we see the teeth, we see the hair on this cyst. So what do you do? Do you go say like, I'm gonna go to a witch doctor, I wanna go to I'm gonna go somewhere, I'm gonna go to somebody else who can take this one because it's abnormal? No. Have a surgery, please.
Yeah. And actually you can pray to God, and we'll talk about it. We'll talk about all this when we come to the end, and it can disappear. You know, we worship a holy God, a God of miracles. So but you know, do whatever you want to do, because when I start talking about spiritual stuff, most people don't get it. So whatever you want to do, just discuss it with your doctor, do it. But if you have ears to hear, God can hear you without surgery. So teratomas, the reason why they develop, this is so weird, because this egg has not been fertilized yet, but it has the germ cells, because you know the ova and the sperm, they have germ cells, and they start developing as if they've been fertilized, and it has teeth, it has hair, and pieces of skin in it. Weird.
And who fertilizes his eggs? Was that the way Jesus was conceived, or what? I would be curious.
God forbid. Now we have God can do anything. The devil can do some things also, but let's keep talking. So the fourth one is a cyst adenoma. It's not cancerous. All these cysts, every cyst we're going to talk about today is not cancerous, but it could change. Things could change, and they can become cancerous, and I'm going to talk about them. So cyst adenoma is fluid. It's a cyst that's filled with fluid and mucus. So, and then we have the endometriomas, which is like related twin sisters with endometriosis. And this is where the uterine tissue grows outside of the uterus. So we talked about that in details last week. So go listen to that.
Like 28 days of periods.
28, it's a menstrual cycle. It's not 28 days of periods. It's 28 days of a menstrual cycle. Because, you know, there's stages.
You get so irregular. That's my understanding.
Now, with PCOS, it is irregular. Some women only have a period like 9 times in 1 year instead of the 12, or less than 9 times. So their periods are, they go for more than 28 days. They go for more than 35 days. And then when they have their periods, they're heavy and they're very painful, and the women are irritable. Okay. So signs and symptoms. The signs and symptoms of PCOS. And as we continue talking, let me just warn the listeners, women, I am not, if you suffer from this problem, I am not attacking you. And I know sometimes it might feel like that, but let me explain, and I'll come back and redeem you towards the end, because this is not your fault. If you suffer from this condition, it is absolutely not your fault. And I realized that as I was preparing the lesson. I knew it was going to be a difficult lesson to discuss, but let's discuss it, because when I tell you the truth, then you know what's causing it and you know how to fix it.
And we are talking about polycystic ovarian syndrome.
So now we are talking about the signs and symptoms. So we've already touched on a little bit of that. Long menstrual periods, mood changes, pain, heavy bleeding, and also some women, this problem starts right at puberty. So they are young girls, and right off the door, right off the gate, they're starting with a problem. So you better know this is not their fault that they're going through this. Other women, as they get older, they start gaining weight, and boom, all of a sudden they have polycystic ovarian syndrome. And this problem also causes infertility. most women who are going through this do have.
Stop there. So if you gain weight suddenly, that can cause Polycystic Ovarian Syndrome and can make you infertile.
It's not the weight. Because weight, and we're going to talk about weight in detail, because most people misunderstand weight. They think weight is an issue with nutrition, that you're eating too much. This is a hormonal problem. Hormonal problems will make you gain weight. And even if you eat healthy, you go to the gym, you still can lose that weight until you fix the root cause of the problem. So as they're getting older, maybe more stress is adding up, and they're having more hormones are going out of work. And that's why they're gaining weight. Yeah, so it's a symptom. The weight gain is a symptom of this problem. But it started way before they even had the problem. It was already there. But so, like I said, some women start right off the gate. They start their menstrual cycle and they're dealing with this. Others don't deal with this right away, but as they grow older, they deal with it. That's why I'm talking about that. So the diagnosis, when you go to the doctor, they look at two things. If you have two symptoms of what I'm going to talk about next, they say you probably most likely have the disease. So what are the two symptoms they look at? So irregular menstrual cycles, infrequent menstrual cycles, prolonged menstrual bleeding. So that's one. So an example would be a woman who is going for more than 35 days, bleeding for more than 10 days, that kind of thing. They also might do a hormonal blood test. So if you have excess androgen, the male hormone, and you can tell women who have extra male hormone, they have a lot of facial hair. They even have a beard. They have a lot of body hair. And then as they grow older, they start losing hair. They start balding like men. So yeah. So that's one of them. So a lot of body hair, facial hair, and baldness. And also acne. Acne is another one. So yeah. So the doctor will be looking at those things. And if you have just those two that I talked about, that's a sure sign that you do have the problem. So then they might do an ultrasound and they can see your ovaries. The ovaries are a little bit larger and they look like they have like grapes inside, because of all those eggs that the woman is holding on to and not releasing them. So they make your ovaries bigger and it looks like it's full of grapes, like a bag full of grapes. That's how it looks like. Yeah. So then the signs and symptoms, if you're a little bit obese and you have this problem, then, that's another thing. So when the doctor sees you, most of the time, when they see you, they will be more concerned with your symptoms. They will try to manage your symptoms. If you have excess male hormone, what can they do to manage that? Like give you some medication to tone down the male hormone. Worsening body hair, they can give you medication to kind of make your skin more smoother. They can give you medication for acne. They can give you medication to grow hair even. They used to advertise for the minoxidil. Remember that drug? They used to advertise. Yeah. The side effect of that drug makes people grow more hair. And they used to advertise. And I remember there was a woman in Kenya, I don't know how she got the medication. It's supposed to be a prescription medicine, but she got it anyway. And she started taking it and she grew a beard. Instead of the hair on the head growing, she grew a beard. So don't do that. Don't do that.
Male hormone.
Yeah. No, she was taking, this is not a male hormone, but the side effects of the drug, minoxidil. Yeah. So the side effect of the drug is to more hair.
You grow too much.
She thought the hair on her head was going to grow, but instead she grew the beard.
All right.
I don't know.
What else?
Complications of this problem. The complications are a big list, but let me go through them very quickly. Infertility is one of them. So sometimes most people who have a hard time conceiving and you're going through this, you probably have polycystic ovarian, but not every woman who is having trouble with getting pregnant has this. Just gestational diabetes. When they get pregnant, they have like gestational diabetes. And when the baby comes out, they are back to normal. And by the way, that's a warning sign that sometime down the road, you are most likely to come down with type 2 diabetes if you're getting diabetic when you're pregnant. So that one. Pregnancy-induced high blood pressure. That's another one. Miscarriage, premature babies, non-alcoholic fatty liver disease. That's when you start gaining weight in the middle. You know, your stomach is big, your liver is enlarged. And when your liver becomes enlarged and it has a lot of fat in it, the fat is actually bad because it poisons. It's very toxic and it's inflammatory. That means your liver is on fire. And I don't know, I was reading somewhere that the liver was named the liver because that's where we live from, like life comes out of there. But I don't know about that. But the liver does make a lot of hormones. It makes a lot of neurochemicals. It makes a lot of vitamins. And it also cleans your blood. So the liver has a lot of stuff to do. Yeah. So if your liver is inflamed, you are in bad shape. So another complication is metabolic syndrome. And this is where you find people gaining weight. They have high blood pressure. They have high blood sugar. They have abnormal cholesterol. They have high triglycerides. And they are also obese. That is metabolic syndrome. And that puts you on a fast track for heart and vascular diseases. So not good. Yeah.
You have a question to answer also when you finish.
Okay. All right. I'll try to finish quickly and answer the questions. Then there is type 2 diabetes. There is pre-diabetes. There is sleep apnea. Can you imagine this?
So wait, you talk about diabetes. So this problem will cause you to have diabetes?
Yeah, it's related. PCOS and diabetes, type 2 diabetes, they are related. This is like the little sister of type 2 diabetes.
Oh, of course, we talked about last time, like the person, the listener who called the show last time, like, was being treated with diabetes medication, meaning that, and she never had diabetes. They have no family history of diabetes, but all of a sudden she was told she had type 2 diabetes.
So yeah, most people get treated with metformin, which every type 2 diabetic is put on that. And you know, there's that story about metformin and metformin having some chemicals that are not good. So Alex, I know by now, you know, all the diseases we discussed, do you see they are all related?
Pretty much all related. And before there was a question here from J.M. Mwaliama. Hormonal problem in ladies, can it cause imbalance problems in terms of reproductive system?
That's what we are talking about, hormonal imbalance. Once progesterone, estrogen are out of whack, once you're producing too much male hormone, yeah, you will have all that and infertility.
Stay here, stay tuned, and you run more.
Yeah. So, okay, so sleep apnea. Now, this is totally unrelated to the whole thing. Yeah, but it's a complication of this problem. Depression, anxiety, eating disorder like bulimia, emotional eating.
You see bulimia with teenagers though.
Where they binge and purge. And also anorexia nervosa, which is very common in the US. Bulimia is also common. We never saw this in Kenya, by the way. I've never seen anorexia nervosa in Kenya.
You didn't have a lot of food to choose what you want.
It's not the food. It's not the food. This is not a nutritional problem. And we'll talk about that towards the end. So the eating disorders, binge eating, emotional eating, it's like food becomes love. So people are eating it's an addiction, just like any other. So for the eating disorder here, they choose food. That's their drug of choice. Then there is also abnormal uterine bleeding. Well, I think we already touched about that when we say prolonged menstrual periods. But it can also lead to endometrial cancer. That is uterine cancer. So it's pretty complicated. So diagnosis. There is no definite test for this thing. You just have to combine all these signs and symptoms. And if they do an ultrasound and they see that your ovaries look like they are sacs with grapes inside, then the diagnosis, you got the diagnosis. So the doctor will normally do a good history and physical about your menstrual cycle, about your weight, about your diet, all that good stuff. And then they might do a physical exam checking hair distribution, acne, signs of pre-diabetic. Remember pre-diabetic condition when we did the darkening of the skin under the arms, at the back of the neck, acne. So that's a sign of insulin resistance. So the doctor is looking at all that. And then they might do a pelvic exam, you know, trying to feel your ovaries. Can they feel them? Are they enlarged? Are they painful? And then eventually do an ultrasound if they find that they need to do that. So it's a workup leading to everything we talked about. A good doctor will also analyze your hormones. So they will want to do a hormonal check, the estrogen, the testosterone, and we can measure those. Progesterone. Progesterone, by the way, is the calming hormone. When a woman is calm, everything works great. But when a woman is not calm, then they have estrogen dominance, and they also have the male hormone, too much of it.
How can they get the calm hormone?
We'll talk about it. Good question. Good question. So a good doctor will also do a fasting lipid. So you came here with women problem, a menstrual cycle, and the doctor is checking your A1C, they're checking your cholesterol, they're checking your chemistry, and they need to do all that. The chemistry checks for complete metabolic panel. So it's checking to make sure your kidneys are working properly, your liver is working properly, and your body chemistry is good. So, and I did mention the ultrasound. Make sure if you have this problem, you get that checked. And ultrasound are a little bit expensive, but there is a need to check it. Then the doctor might go a little bit deeper and screen you for mental illness, because this thing is also related to mental illness, anxiety, depression, bipolar. And a good doctor.
What causes what? Is it the Polycystic Ovarian syndrome causing mental problems, or the other way, the vice versa?
I would tie it all together. Okay. In the end, because you have to wonder what came first, the chicken or the egg.
Okay.
Yeah. So then a good doctor will also do a sleep study to make sure that you're not having obstructive sleep apnea, because that will just worsen everything. It makes everything worse. So treatment, how do they treat it? Well, normally they just focus on managing the disease. And this is where I'm okay that they're doing that, because they will relieve the symptoms, but I wish to go a little bit deeper than managing. I wish to go to the root cause.
Can we cure this disease? Can we say you have polycystic ovarian syndrome, you cannot get a baby? Can we cure this and you can start getting babies?
We can. And actually, we are doing this at a good time, because December is almost here, So if you have this, prepare to have a baby. And when you do have a baby, if it's a girl, you can name them after me, because you had this from me first. If it's a boy, you can name them after Alex. Yeah, you can cure it. Treatment. PC. So we focus on managing the symptoms. We focus on managing infertility. We focus on managing the hair distribution, treating the acne, treating obesity. And so sometimes lifestyle changes and also medication. But if you already know this, this is not a nutritional problem. And yeah, the lifestyle changes are good, but telling someone to reduce their carbohydrate, exercise, it's not going to cure this problem. And I'm going to quickly go over the medication that we use, because it's important before we get to the root cause. So, okay, we might use birth control pills. Now, if the doctor uses that, it's going to be even more harder to have a baby. But it's okay, because it will relieve your symptoms. So they might use a combination pill, which is estrogen and progesterone combined. And this is to decrease the male hormone, or to offset the male hormone and make you feel a little bit better, and also to regulate your menstrual cycle. So they might do that. They might also give you progestin therapy, the mini pill. You know, you take it for 14 days and then you stop taking it and you have your menstrual cycle. And once the menstrual cycle is over, you go, well, the doctor will tell you how to take it. You start over again and you take it for 14 days and then you stop. So this is just to regulate your menstrual cycle and maybe help with your mood because you will feel a little bit better. Now, if somebody is trying to conceive, sometimes they will give you medication to help you ovulate, like anti-androgens. This is to tone down the male hormone and help you maybe get pregnant.
But one thing I hear about with people with this syndrome is that they I cannot get a baby. I cannot conceive. I'm done. I gave up. I'm not giving up. I'm done. And the doctor said I cannot never have a baby, so I don't consider even having a baby.
Well, the thing is, they're taking the doctor's word as the gospel truth, and it's not. So I am a nurse practitioner, and I can tell you, always do what they're telling you to do, but don't listen to what they're saying, because God is the final say. And if God says he's going to bless you with a baby, I can tell you numerous women who are told they will never have a baby. And lo and behold, when they stop worrying about it, they have a baby, you know? So I'll tell you how to fix all this naturally.
Wow.
Yeah. So Femara is another one. And Femara is also used in treatment of breast cancer. Alex, do you remember us doing about breast cancer? No. And we got to the root cause of it? I thought I did that. I'll check. If we didn't do it, I'm gonna. We're gonna do it because the root cause of breast cancer is also related to this problem. I mean, these things they are all related.
Once you understand the body, you understand what causes what, where the problems comes from, and how can it be fixed.
Yeah. So Femara is used to stimulate your ovaries, and it's also used to treat breast cancer. But normally it's a hormonal, breast cancer, most of it is a hormonal problem. So they give you hormones to kind of take care of things. Metformin, this is where a drug that's used for type 2 diabetes is used to treat this problem.
Treat the problem with ovaries. Wow.
Yeah. So it's supposed to slow down. Normally it reduces inflammation, and it's supposed to slow down the progression of type 2 diabetes. Now, they might also give you medication hormones to stimulate your ovaries if you're trying to get pregnant. And this is done by injection. You inject yourself and you stimulate your ovaries, and hopefully they release the eggs so you can get pregnant. So women have had to do that. The other one that they give is Adapton. Adapton kind of blocks the male hormone, the androgen. And this one is not good. If you're planning on getting pregnant, this is not a good drug to be on. So if the doctor has to put you on this, they also have to put you on birth control pills and tell you that if you suspect that you're pregnant, you need to stop it and go see the doctor right away, because it can cause birth defects in the baby. They might also give you a cream to put on your face. So if you're growing facial hair, to kind of, to stop it. They also do electrophoresis, but this is a physical thing where they go and burn the follicles of the hair. But if you're having this problem, you're gonna need a lot of electrophoresis to burn the hair follicles. But there's a better way to deal with this, because if you go get electrophoresis, you can get burnt. Your skin can be burnt, but it does get better. There's a better way, and we're going to talk about that. So now we are going to the causes. We are going to the root cause of this problem.
Root cause of polycystic ovarian syndrome. All right, ladies, gentlemen, you hear for yourself.
And according to research, they say that well, what do they say? According to research, they say the exact cause of PCOS is not known. And this is where I love this, because today you're going to learn something new. So if they tell you the exact cause of it is not known. Today, we're going to get to the cause. And once we get to the cause, you can fix it. And this could be a problem of the past. So one of the things they look at is insulin excess. And they are true, but they are only half true. And this is, insulin is a hormone. It's produced in your pancreas. And what insulin does, it's like a key. It's a key that opens the cells to allow sugar to go inside. So it just opens the door. So what happens in this condition, your body cells are resisting insulin resistant. So your cells are saying, they're saying no to insulin. Now you cannot open this door, and they're refusing to accept the key.
So you're producing insulin, but your body cells refuse to open it, the cell to get the sugar.
There's a reason why they are refusing. We're going to talk about that. So that will give you a hint what the problem is. Normally, if you see insulin resistant, it's because there's poison in the blood. And you might wonder, where is the poison coming from? Well, the way the body works, the body is very, very smart. When you're angry, remember I said that the woman is at war? When you're angry, anger poisons the blood. And that's why the cells are resisting to open the door. They are saying, no, you can't come in here. Because if you bring the poison inside the cell, we're going to die. And they know that. So they're saying, no.
So what's in your body? What's in your blood that's sensing it? So is it cortisol or what is it?
It is cortisol. Cortisol behaves like sulfuric acid. So that's when you produce too much of it, it's poisonous. When you produce too little, you're dead. You just have to have the right balance. So in this case, remember I said the adrenal gland are also being very active. They're producing the male hormone. So they're doing that.
Help me understand in this case. So you are here, you're producing too much insulin, but the insulin is not getting in your cell because you are so angry. Makasiriko kunayo mengi sana. You have produced a lot of cortisol, which your body is sensing as poisonous. And when this insulin comes in your blood system, it's saying your cells are saying, no, we are not going to let you in because you cannot process the sugar because the cortisol is so high that the body is sensing it as so toxic. So you're killing yourself.
And I say this is where I say I ask for forgiveness, because the people who are affected will feel like I'm attacking them, but I'm not attacking you. I will redeem you in the end, because this is not your fault. Okay, so let's keep going. So that's exactly what's happening, Alex. There's poison in the blood, and that's why the cells are resisting insulin. Now, what happens is the cells are still hungry. So they send signals to the brain. They are saying, we are hungry. And the pancreas is being told, produce more insulin. Why aren't you producing more insulin? Produce more insulin. So there is hyperinsulinemia. And hyperinsulinemia just goes and takes all that sugar that the cells are refusing to accept, and it converts it into fat. And that's how the people get bigger, and they're trying to lose weight. But because there's poison in the blood, nothing is working. They're also overeating is coming because the cells are still hungry, but they're now getting the food.
You have too much insulin circulating in your blood system, but there's no sugar, or what? I'm trying to understand this.
The sugar is there, but it's not being allowed to get in the cells.
The cells. Oh,
yeah.
Okay.
So
and that's converted into fat.
It's being converted into fat. So that's how all that fatty liver disease is coming about. That's how all that weight gain is coming about, because there's hyperinsulinemia. And at some point, the pancreas is going to get tired. The beta cells are going to get tired of producing too much insulin. And when they get tired, they get fatigued, they die. So now you become type 2 diabetic. So this problem is very closely related to type 2 diabetes. So that's one thing. So I'm putting my own little thing, and that's why I said, yes, excess insulin that's true, it's causing the problem, but there's a reason why the cells are refusing to accept the insulin. The other thing they looked about is, now we are talking about research and the cost. So I'm just taking the information and I'm explaining it and putting my 2 cents in it. Low grade information, which is true, because type 2 diabetes is a low grade inflammation. It's systemic inflammation when you actually have type 2 diabetes. But in this case, only the ovaries are affected. The ovaries are affected, but eventually this thing might spread to the rest of the body. So chronic, prolonged, low-grade inflammation, the word inflammation comes from fire. When you hear the word inflammation, always think about fire, always think about anger. Yeah, that's where the fire is coming from. So it's a cold, silent, icy fire going on. So I say the anger poisons the blood, and when it's prolonged, when this is not resolved, this will continue to get worse as time goes. So there is also the hereditary thing that they looked about. They noticed that certain women are born and they have a tendency to get this disease. Their parent had it, their grandma had it, now they have it, most likely their children will have it. And we've talked about hereditary diseases on this show a lot. And when you see that going on, it's not your genes. It's not the genes that are doomed, like you're born with bad genes. It's because it's spiritual. You know, there is a curse going down the bloodline.
Wow.
And so that's what's causing that. Excess androgen, or your ovaries are producing too much male hormone. They're producing too much estrogen. They're producing too much male hormone, androgen. And you're having excess hair, you're having acne. Why are the ovaries doing this? So there's that question. And they're producing very little progesterone. And remember, I told you when a woman is calm, they produce enough hormones, and they produce the right amount of progesterone because it's the calming hormone. It's the one that regulates everything. So there's a reason why your ovaries are behaving this way. And also the adrenal gland, they produce DHEA, the precursor to testosterone. So this is a woman who is fighting something, and we're going to dissect that something and see what it is. So some of the lifestyle changes that they tell you to do, which we're going to go beyond food and drink.
Have a man in your life and have him take good care of the stuff the woman should, the men should be taking.
Okay. You're on the right path, Alex. So, but according to medical science, they tell you maintain a healthy weight. And we've always talked about weight. And actually, we're going to talk about weight in more detail, because most people think people who are obese are overeating, and this is not an issue with food.
This is a hormonal problem. This we are running this. No, has nothing to do with pretty much what you eat.
It has something to do with hormones, and that the root cause is not nutrition.
No.
Okay, so they tell you maintain weight, but weight is a symptom of something else. They tell you to limit your carbohydrate. They put you on a ketogenic diet. So now a ketogenic diet is very, very difficult. It has like 10% carbohydrate, the rest high-fat diet. You suffer constipation. It's a very difficult diet to maintain long-term. So now even the foods you like, you're not allowed to have. Difficult. And they tell you to be active, but no matter how much weight you pull at the gym, how much you exercise, you're not losing the weight. It's very, very difficult. So the root cause is actually, and just bear with me because I'm going to tie it out. The fifth commandment, you know, the 10 commandment, the fifth commandment says, honor your father and your mother so that your days may be long. So you can live a long time. If you're suffering from this, where you're having infertility, you're having type 2 diabetes, and you had all the complications I talked about, you're having premature babies, you're having miscarriages, something terrible is going on. So this condition, it seems like there is also the spirit of death when I look from the spiritual perspective, because this thing will eventually kill you. Sleep apnea. You know, so the fifth commandment is what the problem is. But this is a woman who is fighting with her parents. And it's not their fault, because maybe something happened to them when they were young. They were not treated properly by the parents. And we know that this is going on. They've been wronged by the parents. And so there's conflict, there's strife in their relationship. When that happens, you will find that your reproductive system will be behaving out of whack. So this is clearly tied to the fifth commandment. And I'm saying it's not the woman's fault, because some parents, some people, I've had stories of people who behave like they were raised by wolves. And it's very hard when your parents don't take good care of you. It's hard to even forgive them. It's hard to have a normal relationship with them. But when that happens, if you don't, then problems. Because, and you know, the Bible doesn't say honor them if they're good. But what do you do? Because most children, when this happens to most young children, they don't know how to deal with this. This is something they live with for the rest of their life. So now you have an angry child, and the child has now resolved the conflict, and everything that happens to you is logged up in your subconscious mind. And your subconscious mind is your soul. So you don't deal with the anger. And for some people, it's very difficult. I remember I was talking to somebody who was actually molested by their uncle, and their mom didn't do anything. And we know that stories like that are all over the place. So she was angry with her mother. And when I told her the only way to resolve this is to confront them, she was afraid to do that because this abuse was going on. So she already had developed anxiety disorder, and it started when she was 9 years old. And yes, she did struggle with weight. So that's why I'm saying it's not your fault. We know what's going on in the world. We know some of the things that have happened to people as they're growing up. But if you don't resolve it, and this is where it gets difficult, because when you hold on to that anger, if you don't release it, then it kills you. It actually destroys you. It becomes bitterness, and it goes down to your cellular level. So I was reading some research on Tuesday, April 10th, 2018, Health Day News. There was a research that looked at 17,000 women in Britain, and they said that polycystic ovarian disease has an increased risk of mental health problems. So now we are talking about ovarian syndrome, but we are going into mental health. And they looked and they saw that they couldn't prove that this was the cause, but we know it's the cause. So they noticed that most women suffer from depression, anxiety, bipolar, eating disorder. And that's why I was talking about all those eating disorder, anorexia nervosa, bulimia nervosa, binge eating, emotional eating, and also PMS. And this is where men need to pay attention, because you can help your woman actually resolve this. If you love a woman, you can help them deal and work on forgiveness, because that will be the only way out. And if you do it, God says he will repay. He will repay all the lost years, and he will turn your ashes he will make your ashes beautiful. You could actually start even your experience. You could go help somebody else. So it can be turned into a ministry. It can be turned into good things. God knows that it's not your fault. But if you don't forgive, then it becomes an issue. Because God says, let me repay. He says, the war is mine. So for us, even though it's difficult, we have to work on that. And I'm telling you, forgiveness is very, very difficult. I had to forgive some people in my family, no, because I had a great childhood. I was never abused. But there are some things that happened in my family when we were adult people. And it took me 5 years to forgive them. So I know how difficult forgiveness is. And it hurts like crazy, but it is the only way out. And sometimes when you suppress this anger, it don't go anywhere. It becomes like anger without direction. And normally it just sits there, but it goes down to your cellular level. So now you have poison in your cells. And that's why your body is behaving like this. I was going to talk a little bit about forgiveness, because forgiveness is very, very painful. Those suppressed emotions that you suppress because you didn't want to deal with them, maybe it's very painful, they have to be dealt with. And this is so painful that most people would rather not deal with. So, but there is the only way is for your heart to break. But once it breaks, then you can start healing. PMS. Yeah, so many men have had to suffer with this. I know I was reading a story. I actually had to stop and laugh. I was reading a story of a guy who married a woman, and they had dated for quite some time, but he hadn't noticed this side of her. I don't know how, but he hadn't. So they got married, and it didn't even take long. Within 2 months, he knew the marriage was not going to work. So one night, this woman told him, pulled a knife on him and told him, you better not go to sleep. Because if you go to sleep, I'm going to kill you. And she was suffering from PMS. The guy moved out of the house that night and knew that the marriage was not going to work. But he did help the woman. He did the best he could to make sure that she got the help that she needed. But that was it. Because he got scared. You know, if somebody tells you better not go to sleep.
Wow.
Okay.
So what can we do to help somebody who they are there and they are suffering with this? They are not sure if they are suffering with this or they have this. And what can we do? What can we do to help them?
Therapy will help, but if you call me, we can do it the right way, because most therapists are not tapping into the spiritual path, but they'll help you deal with forgiveness. Most therapists know how to help people with this forgiveness and not living in the past, because as long as you live in the past, you're gonna be glued to hell. The past is the glue of hell.
We're saying that the way I understand is that this Polycystic Ovarian syndrome has a root cause as a childhood. There's a repressed anger. There was something emotional thing that happened in this woman's life when they were young. So technically, what about those? Can it happen to somebody after they are in 20s and 30s, or can it happen at that point, or how?
It could, but it's difficult because we are dealing with the 10 Commandments. If you have a good relationship with your mother, there's no strife there.
What about go ahead.
There's no strife there. Now, if you get married to somebody who is going to torment you, you might develop something else like fibroids. You know, when you're producing too much male hormone, you know, you're fighting, you might develop fibroids. So, I mean, these things are all separated and related and separated. But when you're dealing with something this major, PCOS, is a problem with the parents. So and most likely your mother.
The most important question is, can somebody with polycystic ovarian syndrome be treated or have a baby? Or be treated to have a baby?
Absolutely. Once you deal with the anger and that's removed, the poison is removed. So yes, your hormones will normalize. You will have regular menstrual periods and you can conceive. Yes. So let me give you the stats on statistics. How, remember, we have talked about the law of love. That most of our diseases actually originate from that. There is broken the law of love. Is so the veteran families, they suffer a lot because when people go to war, they come back traumatized. They say they have PTSD, and normally the people who are affected are not very nice to their family. So you might find a parent abusing a child, not because they want to, but they are suffering also. So they've had trauma. The statistics in America say that 1 in 5 Americans have been molested. What is molestation? That is when you are assaulted and the assault weapon is a penis. Assaulted with a penis. Either you've been forced into sexual activities as a young child, by family members even, and you never, and most people don't tell. They keep this as a secret. So the other way it's going to come out, it will come out, and maybe you told your mother and your mother kept it quiet, because some families are just like that. They put everything under the rug. It will come out in a certain way. And one of the ways it comes out is like this. 1 in 4 Americans grew up with an alcoholic parent. 1 in 3 couples have engaged in physical violence. When people fight and they have children get traumatized. So everything, your subconscious mind, it logs everything and it never forgets until you deal with it. So what I can say is men. A man is supposed to be the representation of God in this world, the father figure. So a man, the purpose of a man is to actually represent God in this world. That is the purpose of a man. So to be a tender warrior, to take care of your wife. And that's every woman's dream, to have a tender warrior married to Mr. Amazement, you know. That is a woman's every dream. And when that don't happen, things like this will come. Now, every child's hope is to have a father who is caring, who is tender, who is loving, and those children, they grow up very, very well. So what, do you have any questions?
Yeah, I got a question. Do you have any statistic on race, which race is more affected by this disease?
Okay, that's a very, very good question. We talk about Black people, and the only reason that crews me on this is because the statistics also, the British statistics also say that women who have children like this, who have this condition and they have children, the children are affected with autism. And I know that's very common in Kenya. Maybe it's not that common, but it is there in Kenya, and also ADHD. Now, according to the statistics here, Black families, their children are affected by ADHD big time. But that's a common problem here in America. So it's not just race. I would say Black people are more affected, and only because that father figure is missing. Most households are raised, the children are raised by women, and women are trying to fight, they're fighting racism. They're trying to be men in their family. They are providing for children without help. So that's not good.
Oh, wow. Of course, that was my concern also, because the way things are being going tied together would be my concern. Actually, that's going to conclude our show for today. And this is Diaspora Media Max Radio. And you can like us on Facebook, and you can download our app at DM Max. Our app is DM Max Radio. You can download on Google Play or App Store. And you can like us on Facebook, and you'll be notified when we come live. Today was such a great day that I learned a lot of things that I never learned in my years of nursing career. And I was glad to hear to learn most of those. I hope all our listeners, you have learned something. You can go help your sister, your sisters, your female in your family or somewhere in your community, because that was a lot to digest and that was a lot to learn. And one thing I can say, do not suppress that anger. Do not continue to hold that anger. Once you know that anger, you can deal with it, you can solve it, you can save yourself from diabetes and all other issues that comes with it. You can build up a strong immune system, because when you're still holding on that anger, suppressing that anger, you are killing your own immune system. And at this time of Corona and all the viruses coming out, you don't need to have a weak immune system. Thank you very much. I'm going to give you the last word, Dr. Alice, and we're going to conclude our show.
Last word. If I can help you, I have people who can help you. I can help you also. My main part is to just educate people. So and they don't have to be PCOS, any disease I can help you with. And that's a fact, any disease. So yeah.
Thank you very much. You have heard, ladies and gentlemen. You can reach out to Alice. She's on Facebook, Alice Munua. And also she has a website. Tell us your website as we conclude.
Wow, my website is, I can't even remember, I haven't used it. Get me on Facebook. How about Facebook? Or call the station and they'll give you my number.
Thank you very much. And that's gonna be it for us. This Wellness and Health Show presented to you by KEMEN on Diaspora Media Max platform. Until next week, goodbye.
Welcome to One Man at a Time, the KEMEN Show. Please like and subscribe to our channel.
The KEMEN Show. We are strong together.